Hey, Jacques Santucci here. I'm here with Shawn.
I'm Shawn Hauser. I'm an attorney specializing in cannabis and psychedelics law and policy with the law firm Vicente LLP. And we, both focus on shaping and advancing cannabis drug policy reform and working with great businesses and developing a responsible and good industry and ending the failed war on drugs.
Yeah, so Vicente and you and your team, you've been involved with the policy making, right, of the cannabis industry and now the psychedelic industry.
Yeah, so we were some of the primary authors of Amendment 64, which legalized cannabis in Colorado, one of the first states to legalize cannabis in 2012. And then this last year, we followed a similar path with natural medicine, the Natural Health Medicine Act in Colorado, which legalized for personal use and therapeutic use natural.
I know you're involved with the descheduling of cannabis and also psychedelic. What do you see for the next few months?
I think the next few months are really going to be pivotal for both industries and drug policy reform generally. As you know, the HHS and FDA recently recommended that marijuana be moved to Schedule 3 from Schedule 1, where it was considered to have no medical use and a high potential for abuse, which we all know is very inaccurate given the clear medicinal use and everything law and science and data tell us. And so now, we think the DEA is likely to accept that recommendation. There'll be many improvements from the move to Schedule 3, and then it'll be really on Congress to legalize and deschedule marijuana, impose a regulatory framework that's sensible and includes meaningful social equity and criminal justice reform and a role for the state businesses and incentives for research and all the good things. So a lot of work ahead, but I think finally we're seeing a real shift in outdated marijuana laws at the federal level.
And psychedelic is a focus of yours too.
Yes, absolutely. And with psychedelics, research has been able to advance more smoothly and in some ways improper restrictions on cannabis research. But there's some really promising movement with MAPS and others who are expected to get FDA approval for certain psychedelic drugs to treat mental health and other conditions. And then, there's promising legislation with the Breakthrough Therapies Act and other federal research legislation that's going to, I think, lead to descheduling, rescheduling, and also support research. We need to ensure the safety and efficacy of these products for the mental conditions we know they're beneficial for.